breakthroughs. Turns out one of the biggest discoveries is actually this tiny. See how small that is? This little chip may be the next big thing, and it sounds like it's right from a sci-fi movie, but people all over the world are implanting these into their wrists. So I asked my producer, Dean, to find out more about this cutting-edge technology and what it could mean for your health.
Let's start by giving all praises to the Most High, whose true name in the ancient Hebrew is Yahweh, in the name of his only begotten Son, whose true name in the ancient Hebrew is Yahweh Shai, and the Holy Spirit, which is the Ruach Kodash in the ancient Hebrew. Double honors to the elders, the GMS, who taught us this truth about the Holy Spirit. Honors to the brothers, risking their life and freedom to push the gospel. Peace and blessings to the elect, which would be the so-called Negroes, Latinos, Native Americans, and Seminole Indians, who make up the lost 12 tribes of Israel, according to scripture and according to prophecy. But the elect would be 1/3 of the Israelites who are returning back to the Most High during these last days, which is happening now, so that they receive salvation, while the 2/3 of Israel who don't turn back to the Most High in time be destroyed with America. And that's all according to prophecy. We back with another lesson through the mercy of Yahweh Bahashim Yahweh Shai. Lesson is going to be titled, U.S. Begins Digital Health Ecosystem. All medical files to become digital. Dr. Oz speaks. So yeah, for those who may not remember, Trump elected Elon Musk and Dr. Oz to be part of his administration. Elon Musk, who's an expert in technology and artificial intelligence, and Dr. Oz, who's a so-called expert in health. And part of this New World Order, they want to merge technology and health, man and machine, everything to go digital. So no wonder he got Elon Musk, the expert in technology, artificial intelligence, and Dr. Oz, who's an expert in health, but also technology as well. And I haven't seen Dr. Oz speak a single word all year. I haven't seen Dr. Oz speak since January. So we going on 8 months. So I've been wondering for the past month, man, where this dude Dr. Oz at? We seen Trump, Elon Musk all over the media. Trump, Elon Musk doing all kind of interviews, but I haven't seen Dr. Oz. So I knew at some point he'll come on the scene, and now he's on the scene because we're gonna get this video. It's titled White House Launches CMS Digital Health Tech Ecosystem. Keyword is health. So this is where not only Elon Musk for the digital portion, but health. Hey, now Dr. Oz is coming into play. He's coming on the scene and showing himself. So we're gonna play this video real quick. And again, the title, White House Launches CMS Digital Health Tech Ecosystem. Pretty much, he wants the healthcare to go digital, but we're gonna let him explain it.
For decades, America's healthcare networks have been overdue for a high-tech upgrade, and that's what we're doing. The existing systems are often slow, costly, and incompatible with one another, but with today's announcement, we take a major step to bring healthcare into the digital age, something that is absolutely vital. You got to do it. Moving from clipboards and fax machines into a new era of convenience, profitability, and speed, and frankly, better health for people. Under the leadership of Administrator Oz, we're officially launching the CMS Digital Health Tech Ecosystem to give healthcare providers, insurers, and software companies the tools they need to empower Americans with a 21st century experience on health. The key breakthrough we've made is getting many of the biggest names in the healthcare and technology to agree to industry-wide standards for electronic medical records. All of those great companies that you just heard have gotten together with this group of very brilliant people. I don't know who's more brilliant, them or them. I don't know. Could be them. I hate to tell you, it could very well be them, but I don't know. I'm going to take my team. But the key breakthrough we've made is getting many of the biggest names in healthcare and technology to agree to that those standards of electronic medical records that we talk about and you've heard about for so many years, and now it's happening. This will allow patients to easily transmit information from one doctor to another, even if they're different networks and using different record keeping systems. No matter what system they use, they're all transferable. The new standards will also make it simple for patients to access their own personal health records. I don't want to see mine, please. I don't want to see. I don't.
So he's speaking about the ease of transferring your medical records from one healthcare network or provider to another one, and that also you have access to it yourself. So what's going to make it easier for everybody to access your medical records? How is that going to play out? He's about to say.
About you. They have all sorts of things, sir. They can tell you exactly what your problem is going to be in 6 years. We can do it. You know, they have all these different things. I don't know if they work or not, but I didn't want to hear it. I didn't want to hear it. If they got a problem, I don't want to know about it right now. But it is amazing what they're doing. I don't know. Does it actually work? Can they do that? All right. Well, then I'm glad I said I don't want to know. But thanks to this announcement, healthcare providers across the country will also finally be able to kill the clipboard. It's an expression that's used, capital, with a capital C, kill the clipboard. Instead of filling out the same tedious paperwork at every medical appointment, patients will simply be able to grant their doctors access to their records at the push of a button.
So he said patients will be able to grant healthcare providers access to the information with the push of a button. So with the push of a button, but that really don't make sense. But let's continue.
And you're all set, and all the information the doctor needs will be immediately transmitted. The system will be entirely opt-in, and there will be no centralized government-run database, which everyone is always concerned about. I'm less concerned than anybody. I say whatever it is, it is. But people are very, very concerned about the personal records. They want to keep them very quiet, and that's their choice. I think it's a clipboard. Instead of filling out the same tedious paperwork at every medical appointment, patients will simply be able to grant their doctors access to their records at the push of a button. Just a button and you're all set.
So that don't make sense for a number of reasons. The push of what button? Does everybody have a button, their own personal button that they're going to push? Or is everybody pushing the same button, which is then unsanitary and a health risk? But push a button on what? To give somebody access to your medical files. That's the lie. So you're the button, and inside you is going to be the RFID microchip. Because keep in mind, Trump is talking about this magic button. But we already played the video with Dr. Oz. Let's play it again.
The latest breakthroughs. Turns out one of the biggest discoveries is actually this tiny. See how small that is? This little chip may be the next big thing, and it sounds like it's right from a sci-fi movie, but people all over the world are implanting these into their wrists. So I asked my producer, Dean, to find out more about this cutting-edge technology and what it could mean for your health.
See, he said that microchip is the next big thing. And he said, what can a microchip do for your health? So there is no magic button for nobody to push to give healthcare providers access to your medical records. No, that button is a code word for microchip. Again, which is the mark of the beast. And this microchip will be your digital ID, digital wallet, digital house and car key. Is going to hold all your medical records digitally. Because again, Trump said recently it's going to be the button. But Dr. Oz already told us years ago that it's going to be the microchip. See that? So they saying kill the clipboard, no more fax machines, no more clipboards, no more papers, which a lot of the healthcare field is already digital and electronic. But this is another way to force implement the RFID microchip, which is the mark of the beast. But we're going to get this in the book of Psalms chapter 64, verse 8. So they shall make their tongue to fall upon themselves. All that see them shall flee away. See that? Their tongue is falling upon themselves. Meaning what? They both saying different things. So either somebody is misinformed or somebody is lying. For Trump to say the button, we know Trump full of BS and full of lies anyway. But let's hear it again.
With a capital C, kill the clipboard. Instead of filling out the same tedious paperwork at every medical appointment, patients will simply be able to grant their doctors access to their records at the push of a button. Just a button and you're all set. And all.
See that? Push of a button. Now let's play Dr. Oz again.
Turns the latest breakthroughs. Turns out one of the biggest discoveries is actually this tiny. See how small that is? This little chip may be the next big thing, and it sounds like it's right from a sci-fi movie, but people all over the world are implanting these into their wrists. So I asked my producer, Dean, to find out more about this cutting-edge technology and what it could mean for your health.
Hey, see that? So they should make their own tongue fall upon themselves. So Trump said this recently, but I guess they done forgot. Dr. Oz already told us years ago. So they should make their own tongue to fall upon themselves. All that see them shall flee away. So people gonna realize, America, the government, Trump can't be trusted. People already putting the pieces together realize there's more to this than they telling you. This is their new world order. People piecing it, realizing that the RFID microchip is the mark of the beast. All that see them shall flee away. So all who have eyes to see what's really going on, what they're really doing, they're going to flee. Meaning they're going to depart. Rather they leave the country or rather they reject the new world order and the mandates to come. That's like fleeing. So, physically or mentally, your mind you don't go along with what they're telling you. Now, we're going to get this in Revelation 13:16. And he calls of all, both small and great, rich and poor, free and bond, to receive a mark in their right hand or in their foreheads. So he's going to cause everybody to get this mark one way or another. Rather it's for healthcare, rather you can use the government-based cryptocurrency to continue to shop and to operate in society. Pretty much all aspects of life, this RFID microchip is going to be required. And Dr. Oz is actually set up over Medicaid and Medicare. So whether you need medical care and treatment, health insurance, that microchip is going to be required. And that no man might buy or sell, say if he that had the mark or the name of the beast or the number of his name, so you won't even be able to buy or sell, operate in society, unless you got this RFID microchip, which is the mark of the beast. And buying and selling includes healthcare. Yeah, you don't come out of pocket, but you got insurance companies that comes out of pocket for you. So yeah, that this cancels out, health insurance unless you get the mark. But you see how they gonna close in and pretty much make it impossible to operate and survive unless you have the RFID microchip. So yeah, so now this same interview that Trump is speaking on, I actually got the full interview pulled up, and we're gonna listen to Dr. Oz speak for himself. So let's go there. And the thing, one more thing I want to get about Trump and all that stuff. Um, Matter of fact, we're going to get this interview from Dr. Oz. We're just going to listen to him talk. Breaking news, Trump holds making health technology great. Event with RFK Jr. and Dr. Oz. So we're about to see Dr. Oz speak for the first time this year.
Changes we need to make accordingly. Now, there's one other big reality about making the system more efficient, which is why what everyone here is talking about is so critical. And let's just pick an average American born in 1964. That average American born in 64 will retire this year at age 61. If just that one group of people born in 64 could work 3 years longer because they're healthy, because they feel like they want to do it, because they feel vital and vigorous and they're flourishing, just that 1 year work.
Damn, bro. This nigga Esau on these damn commercials. Hey, forgive me. We're going to go back about 30 seconds and start over.
At risk, and there's some fundamental changes we need to make accordingly. Now, there's one other big reality about making the system more efficient, which is why what everyone here is talking about is so critical. And let's just pick an average American born in 1964. That average American born in 64 will retire this year at age 61. If just that one group of people born in 64 could work 3 years longer because they're healthy, because they feel like they want to do it, because they feel vital and vigorous and they're flourishing, just that 1 year working longer is $1 trillion to the U.S. GDP, and is $300 billion of tax revenue to pay.
So they think making the healthcare field, go digital is going to make the population healthier, and they want to raise the retirement age. So you see that, none of this is really for your benefit. It's just to further oppress the people.
A lot of the problems that people are concerned about. So it's not just keeping people out of the hospital, getting them to thrive and flourish that makes what we're doing so critical today.
So if you want people to thrive and flourish, give them livable wages, give them affordable cost of living, throughout the country. And then, not to mention, most people don't even got access to health care. What about all the budget cuts to Medicaid and Medicare? What about all the rural hospitals that's about to lose funding and be closing? What about all the healthcare providers and professionals being laid off due to hospital and health clinic closures? So instead of, if you really want to help the people, give everybody access to healthcare, free healthcare. Everybody's insured if you really cared about the people. Saying that you want to raise the retirement age to 67, that's crazy. Because people don't want to work. Wages ain't fair. Price of living is through the roof. Inflation, tariffs, taxes. Don't nobody want to work. That's the last thing anybody want to do. The goal should be how to get people to retire sooner. How to give everybody health care. But let's continue listening.
I think there are a lot of realities to how healthcare has gone. Unfortunately, the system is frozen, and it has been for many reasons, despite efforts in the first administration. It's frozen in time, so it cannot address the quality lags that exist. While Netflix and Airbnb and Uber drivers are racing ahead, making arrangements, identifying the problems that are challenging us in healthcare have become incredibly difficult. You can't make appointments. The average Americans are tired. They're tired of waiting for a doctor's appointment. They're tired.
He said that average Americans are tired. Average Americans are tired of waiting on doctor's appointments. No, average Americans are tired of working. Working 40 hours a week don't cut it no more. One income households ain't worked in over 20 years. 2 income households are barely making it. So if the American people are tired of anything, it's not waiting for doctor's visits. No, they tired of working. They tired of overworking and being overtaxed. And that's what these devils do. They say a lot of stuff, talk real fast, so that you don't catch what they saying. But let's go back a little bit so we can hear this devil lie again.
It cannot address the quality lags that exist. While Netflix and Airbnb and Uber drivers are racing ahead, making arrangements, identifying the problems that are challenging us in healthcare have become incredibly difficult. You can't make appointments. The average Americans are tired. They're tired of waiting for a doctor's appointment. They're tired of waiting for the surprise of what your hospital bill is going to offer. That's
Again, American people are tired of anything. They're tired of working. They're tired of being overpriced on everything. Yeah, including, healthcare. But, most people ain't got access to it anyway.
addressed by one of the president's executive orders. They're tired of waiting for access to their medical records. You own your medical records. They're yours. Why?
See, this is the thing. He's telling you, with this digital health renovation that you can own your medical records. Hey, don't nobody care about that. People trying to own a vehicle. They want to own a house. They want to own property. So if you want to make people's lives better and easier, owning healthcare records is useless. Like nobody cares. People struggling to get a home, to own it. But yeah, you see that he's speaking like it's for your benefit, but you owning your medical records, they're your health records. It's yours anyway.
The surprise of what your hospital bill is going to offer. That's being addressed by one of the president's executive orders. They're tired of waiting for access to their medical records. You own your medical records. They're yours. Why you can't have access to them is a stunning reality in modern day America. They're also
Most people have their healthcare records because you get discharge papers, you get diagnosis papers. So what is he talking about? Yeah, some cases, you do have to wait for appointments for certain things. You do got to wait for records to be transferred, sometimes. But why is that? Well, because all the healthcare facilities are overbooked. And they not helping by cutting Medicaid and Medicare. But let's continue.
Tired of waiting for Washington to take action. And this president early on emphatically stated that wasn't going to happen anymore. And today we made that vision into a reality. And there's a fine line between vision and hallucination. What you did today was show it's a vision because you share it with us and we're moving ahead on it. And that's what today's commitments essentially are reflecting. And they are pledges. They're not laws. They're nimble and they're fast and they're quick because the president understands that each of you in your own way understand these needs. And Secretary Kennedy spoke beautifully about the reality of what happens when you actually have electronic records because what he said is happening in Indonesia, we'll have here. Within a year on your device, and 91% of Medicaid patients have smartphones.
Okay, you see that? He said within a year, he said on your medical device. Well, what the hell is Trump talking about with a magic button? Let's go back to it.
Filling out the same tedious paperwork at every medical appointment, patients will simply be able to grant their doctors access to their records at the push of a button.
So with the push of a button, okay, is it a button or is it a medical device? But let's go back a little bit.
In your own way, understand these needs. And Secretary Kennedy spoke beautifully about the reality of what happens when you actually have electronic records because what he said is happening in Indonesia, we'll have here. Within a year on your device, and 91% of Medicaid patients have smartphones.
Okay, he said within a year, medical records going to be stored on your medical device. But again, this is the book of Psalms, chapter 64, verse 8. So they shall make their own tongue to fall upon themselves. All that see them shall flee away. So everybody who got ears to hear, eyes to see, know that they lying. Because did he forget years ago when he had black hair he was already talking about the RFID microchip, which is in the phone, but they want to put it inside of you. So let's go back to that video.
The latest breakthroughs. Turns out one of the biggest discoveries is actually this tiny. See how small that is? This little chip may be the next big thing, and it sounds like it's right from a sci-fi movie, but people all over the world are implanting these into their wrists. So I asked my producer, Dean, to find out more about this cutting-edge technology and what it could mean for your health.
Hey, see that? And that next big thing is happening now. He said 90%. You see how these devils play with the numbers. He said 90% of Medicaid recipients have a phone. Okay, 90% of Medicaid recipients got a phone, but how many people actually have Medicaid? There's more uninsured people in America than people who actually have insurance. So what about those people who don't have Medicaid, Medicare, or no insurance at all? Who gives a damn about a phone? Letting you know it's not about putting your medical records in a phone, because even that's limited. Phones get broken, stolen, hacked. You're constantly getting upgrades. So the solution, which they trying to talk around it, is really the RFID microchip. They may start off with the phone, for the first few months, 6 months, 9 months. Hey, but the end goal is the RFID microchip. That's the end goal. Now let's take this back a little bit so we can hear this devil lie again.
In your own way, understand these needs. And Secretary Kennedy spoke beautifully about the reality of what happens when you actually have electronic records, because what he said is happening in Indonesia, we'll have here. Within a year, on your device, and 91% of Medicaid patients have smartphones.
But again, how many people have Medicaid?
On this device, you'll get insights based on your records if you want. You don't have to take this, but if you desire, Amy Gleason is one of the smartest people I've ever worked with.
And this is the thing too. Let's say you in a car accident, you unconscious, you unresponsive, you can't communicate. Then you got mentally ill patients who don't know how to work a device, but they may have health coverage. Hey, what good is your medical records being on the phone then? You're in an accident, your phone break in a car accident. It's an emergency, you unresponsive. What good is the phone then? But hey, if you unresponsive, unconscious, car accident, mentally ill, not able to speak, if your medical records is in your right hand, RFID microchip, the mark of the beast, hey, then it's all good. So this is not what they trying to talk around it, but we know what the end goal is.
Has built a mechanism to be able to get you that information in a way with all these partners helping, so that you can get nudged to pay attention to what you're eating and avoid processed foods that Secretary Kennedy smartly and wisely highlighted as so dangerous to our well-being. All this, by the way, is that will be at the fingertips. In addition, advice about which doctor to see, when to go see them, nudges, reminding you why I didn't do certain things. If you're a doctor like me, it's a very different story. It's to help you navigate the system better. It's giving you advice, decision support, which is becoming increasingly important as medicine gets more difficult. But I'll tell you the best thing of all, how many of you have been with your doctor telling them something heartfelt, very emotional, and they're looking to the side, typing into their computer, right? It's common. Put your hands up. I just want to see it. Yeah, most everybody. And that's unfortunate, because the whole sacrament, the whole covenant of being with the doctor is having them look you in the eyes and realize you're there for each other. That process is going to go away. We will, within the workflow of doctors, be able, with your help, allow physicians to take.
See, now you're playing on your emotions. You're saying, how many times you talking to the doctor, healthcare provider, they typing in the computer. They looking away and the focus not being on you. Well, first, it's a job. Doctors, healthcare providers, they there for a check first. Actually connected with the people and being able to do so, that comes second. But they there for a check first. And nobody really cares if the doctor is looking at them or not. Now, what people would care about is everybody having access to healthcare. Healthcare being attainable and affordable.
Patients gather the information while they're doing it and will destroy the upcoding that has hurt Medicare Advantage and other programs in a similar fashion. The IT infrastructure that's going to change promises to improve.
You heard that? The infrastructure, the IT infrastructure. That's the mark of the beast system. You know, the supercomputers, the 5G, 6G towers, all the different electronics and ways of validating identification. You know, all the equipment that'll let you, you know, swipe your hand so your microchip can be scanned. But see, there you go. That word infrastructure. You see how he slipped that in there. Because if all your medical records is going to be on the phone, what infrastructure is needed? But yeah, it's about to be a whole healthcare renovation for this cashless digital society. A lot of things. We're going to cut fraud, waste, and abuse. Mr. President, we announced with the DOJ 2 weeks ago a $15 billion bust. $15 billion. It's a multinational criminal syndicate based primarily, we believe, in the Soviet Union, in Russia. And what they did was hack using beneficiary numbers into the system. We'll be able to... Now they lying on Russia. That because of a system that Amy has put together and the wonderful work of Amy Brandt, who has a fraud war room using this kind of technology, because we'll know who you are and who your doctor is. We can block this. We're going to have remarkable advances in how consumers can use their own records. We'll have beneficiaries be able to get MAHA advice and prevention tips and even be able to nudge them and reward them perhaps for that. And all this comes back to one fundamental issue, Mr. President, which is leadership. I think 60 people, the biggest, the best, the willing, came forward because of your leadership, because you weren't going to take no for an answer, and they know it. We are building a robust and safe, I emphasize that, safe system. It's going to protect the data better than we could have imagined. We're going to be able to accomplish goals that all of us wished from day one that would be in place. These pledges are now confirmed. They're signed in public. You have therefore empowered Americans to own their property, which is their medical records. Let me introduce Amy. He said empowered Americans to own their property, which is their medical records. Okay, all of Americans, you know, they can own their medical records, but most Americans don't even own a house. They don't own no property. They don't even own their vehicle. You see that? How they make it sound they're doing a favor for you? Well, help people own property, homes, and vehicles. That'd be more beneficial than having papers that we already got in our file cabinet anyway. And we got these same papers in our email. So we got them electronically or digitally anyway. But empowered Americans to own their medical records. Empower Americans, you know, again, to own a home, to own a vehicle, to own land, to own property. But yeah, man. This is the book of Psalms, chapter 10, verse 7. His mouth is full of cursing, deceit, and fraud. Under his tongue is mischief and vanity. And when you look into this word for cursing, it goes into swearing to do something. And they swear they're going to make America healthy again. They swear they're going to make America better or great. Hey, but that's all a lie. This is all part of them trying to implement the RFID microchip, which is the mark of the beast. So we're going to get this in the book of Job, chapter 16, verse 12. I was at ease, but he hath broken me asunder. He hath also taken me by my neck and shaken me to pieces and set me up for his mark. So they talked about the infrastructure for this digital healthcare, whatever. So they putting the infrastructure, the hardware in place. All they need is the right crisis to implement it, to push it. That's why it says, I was at ease. That's now. We at ease. But he have broken me asunder. He have also taken me by the neck, shaking me to pieces. This is what? That crisis that they waiting to take you out of this easy life. They wait on the right crisis so that you no longer be at ease but you be in straits, which means to be in a difficult position. So they got their hardware, the infrastructure, but they're gonna need the right prices to make that hard push. So they setting up for the mark right now. So we also gonna get this in the book of Revelation 19 to 20. And the beast was taken with him, the false prophet that wrought miracles before him, with which he deceived them that had received the mark of the beast, and them that worship his image. These both were cast alive into the lake of fire, burning with brimstone. So ultimately, those who get the mark of the beast, RFID microchip, Neuralink brain chip, they're going to be cast alive into the lake of fire, which is the nuclear destruction of America. But it says the beast, the false prophet, who deceived them that received the mark. To deceive is to intentionally lie to somebody. So they're deceiving the people right now. They're making it a thing of convenience. It's going to help the people, help the people live longer so they can work longer. They can own their medical records. That's him deceiving the people. Because what he's trying to do to you is trick you to get in the mark of the beast. So they know exactly what they're doing. But showing, those who get the mark, they were deceived into getting it. So yeah, that's the title again. U.S. begins digital health ecosystem. All medical files to become digital. Dr. Oz finally speaks. But we done broke down a lot of stuff they say. You see how it's all lies. So, hey, Lord Wooden, that was informative. See you next time. Shalom.